Shannon. I am an LAMFT and I have a practice in Chandler called Seen, Known, Loved Therapy. I work very, very often with ADHD. That's kind of my thing, right? I got diagnosed with ADHD myself like 3-4 years ago. And I feel like it became my hyper focus, which was really nice to be able to learn everything that I could about ADHD and take all the trainings that I possibly could. I also work with couples and families though too. And I think that ADHD plays a huge role in relationships. So a few of these slides, again, if we have time for them, there's some indicators of how ADHD does show up in relationships and how to kind of talk through that with clients, kind of what they need in those moments too. So feel free though, if you do have questions, thoughts, put them in the chat and we'll make sure and go through everything. All right, let me move you all just a second here so I can see slides. So let's talk about ADHD. So overview of what we'll talk about today, just typical symptoms, experiences that people have if they do have ADHD, the effect of ADHD on individuals and relationships, a few practical tools, and a few key interventions that I think work well with most all clients with ADHD especially. So this talks about how no one is ADHD and should be defined or categorized in terms of it or any other particular problem. And this is from Gabor Mate. He talks about that recognizing ADD itself really just calls for some knowledgeable and creative approaches, not necessarily judgment, right? And this recognition should help the child fulfill their potential, not limit them further. Sorry, I'm trying to figure out how to move you all so I can see my screen. So approximately 11% of children and 7% of adults in the United States have been diagnosed with ADHD, which is likely underreported. And right now, the worldwide percentage is about 5 to 7%. But it is important to note, as I mentioned before, research on women and people of color is very much behind. Most research has been done on white male children, and we don't really have the understanding that we really need for adults and women and people of color. So that really makes it difficult when we're looking at the traditional screening methods to try and figure out, is this ADHD? Is it something else? Or are there maybe a few things happening? But men do get diagnosed twice as often as women, and the condition is very, very highly inheritable. ADHD can be described and characterized by that deficit in attention, obviously. It looks like distractibility, impulsivity, and motor hyperactivity. So that's the fidgetiness in a lot of people. 3 different types: predominantly inattentive, predominantly hyperactive impulsive, or combined, which is the most common type. And that key indicator is really the inability to regulate attention, right? It's not so much can you pay attention, because there are many, many people who can hyperfocus and spend hours and hours and hours and hours focused on one topic at a time. But can we regulate? Can we pull out of that? Or is it really difficult to stop that attention when we're in that mode, basically? There are a lot of co-occurring disorders, and I think that a lot of people get diagnosed with other conditions before they even figure out that they have ADHD, especially adults. But there are many people dealing with eating disorders, sleep issues. That is sometimes a result of delayed melatonin release, emotional dysregulation, addictions. And there's a lot of reasons for the addictions to be an issue, and that's maybe the impulsivity, boredom, emotional regulation. Additionally, we had mentioned before, Christina, the OCD factor too. There are a lot of people who do consider OCD to be neurodivergence. And it is essentially just a different wiring of the brain, right? The brain looks at the world differently. So it is important to know that there is a lot of process. Personality disorders often get diagnosed before ADHD does as well. So it's just another indicator if someone's coming in with a long list of previous diagnoses. Maybe we consider, is there some neurodivergence going on? And as with any diagnosis, those symptoms need to cause some significant impact in order to justify the diagnosis itself, especially since we don't want to just put another label on people. So common experiences with ADHD, really severe sensitivity to disapproval and rejection. And that often goes with those internal messages, right? I am not enough. I'm too much. I'm a burden to my family, to my friends, to my partner. And because of those messages, there's a whole lot of shame and guilt, anxiety, and low self-esteem as a result of even having the diagnosis itself. There is a very strong difficulty with a lot of people in being able to read facial expressions, which can be really difficult in a relationship, right? Not being able to understand what is happening within their partner without having to ask. And a lot of people just don't know how to ask, right? It's actually really difficult for people to feel brave enough to say, hey, can I ask, like, are you okay? Are we okay? Like, what's going on? Because they don't want to come off as needy or too much. A lot of my clients talk about internal noise being just as loud as the external noise. And when this comes up in therapy, a lot of the time is actually when clients are going through medication trial, basically, and they start to find the right medication. So the right medication a lot of the time helps that internal noise calm down. It's not quite so intense. Additionally, the experiences involve difficulty prioritizing tasks. And that's because everything seems just as important as the next. Time blindness is very, very common. Basically a relationship to time that is different from neurotypical people. And that looks like doing something either now or not now, right? It's either going to happen in this moment or I'm not probably going to get to it. Which that's where it's like, okay, how do we coach in those moments, right? Am I writing this down? Am I putting a reminder on my phone? Those types of things are really helpful. But it is a very, very common issue. And it helps, or it really is difficult to learn from past mistakes because of that. Disorganization is a huge indicator, as well as procrastination. And that could look like difficulty starting or stopping the task. Lots of the time that procrastination is fear-based and could be a fear of failure or a fear of success. Right, if I actually do the thing and it turns out okay, what does that mean for me? The uncertainty behind it is actually scary sometimes. All right, so late diagnosis, adult diagnosis comes with its own range of emotion, and that usually involves some grief, right? That grief also involves anger, usually at themselves, maybe for not picking it up sooner, at their caregivers, their parents, whoever it was that saw them growing up. Why didn't they see this? Why didn't they understand that I was dealing with this? Why did it take so long to figure this out? There's a lot of questions that I've noticed of people not really understanding their own identities sometimes even, right? Are all of these quirky things that I thought were just part of my personality actually indicators of ADHD? And what does that mean about me, right? What is my personality? Who am I kind of feeling? And I've seen this especially in couples actually who are questioning past life decisions, even major ones like getting married. Did I pick the right partner? Would I have made the same decision if I had known about my ADHD? And I'd put in there about 20% of people in the US are diagnosed with ADHD, meaning there's about 80% of adults with ADHD who do not have a diagnosis right now. which is a big challenge, right? Moving throughout life without really knowing what's going on. All right, so effects on individuals, on relationships. Individuals often feel shame and guilt over these different aspects of their brain wiring that are really difficult to manage, to navigate. And the thoughts that go through your mind are very paralyzing. It's that feeling of what if I can't improve? What if I can't keep it up if I try? What if, what if I try and I fail over and over and over again? And then as well in relationships, the partner of the ADHD person likely needs to grieve as well when they got that adult diagnosis, especially because there is this coming to terms with, oh, my partner probably cannot show up for me in the way that I sometimes hope or expect them to, which is a big challenge. So I'd mentioned in there, showing up on time is a big issue for people. And when someone's consistently not showing up on time for you, not remembering big anniversaries, big dates, plans that you thought you had communicated with them, then that partner feels really not important, right? Feel like I'm forgettable, I'm not worth it, I'm asking too much. And at the same time, the partner with ADHD has a lot of shame around it, right? Feeling incapable, inadequate, rejected. And again, either not enough or too much, all at the same time. So a few key interventions that I've found for individuals that are really helpful. And honestly, those first few sessions, letting someone come in and just talk it up. I found, especially lately with I don't know what it is with a few of my brand new clients. It's really hard to get a word in sometimes, right? Like they're just going and going and going. They have so much that's been built up, so much that's been pent up, and they just need to get it out. So letting them have that space to get it out is actually the most helpful thing you can do in that moment. And then it gives them space once they've been able to get it out, to release it, to start very, very, very slowly slowing down, reflecting and thinking through. And so that's where we can reflect what we hear them saying in the pauses. And that allows them to feel validated, or it helps us to challenge some of the thoughts too in a really gentle way. Because again, remember that rejection sensitivity is a major factor with ADHD. So how do we say things in a way that can be received, right? In a way that's not going to be hurtful or overwhelming. And that's where, for me, it's gradually slowing people down using, so I use EFT. I'm trained mostly in EFT, and risk is a major intervention with EFT. And that's repetition, imagery, metaphors, making speech slow, soft, and simple. Right? And then using the client's words and language back to them, helping them feel understood, and it helps them genuinely slow down. And that's where helping individuals pause and reflect truly takes time. It could be a couple months before you're feeling like, oh, we're able to have that back and forth that I might be able to have with neurotypical clients, right? And that's okay, honestly. They just need you in those moments. They need someone to validate them, listen to them, and honestly make them feel seen and not crazy. So we just need that sometime. But that's where I put in there. It's really important to gauge over time which clients need to be paused and stopped and which ones just need to talk through, which is a challenge sometimes. I have clients who will start a story that feels a little unrelated, and it's like we're off on a side quest, but then they loop back and it's like, oh, that's how it connected, right? In their brain, this connected to like 13 different things all in a second, right? And they needed to get through and process and talk through that so that they could connect back to that main topic. And those are the ones where I'm like, I want you to go through that process, right? I want you to feel like you can go on your side quest and I'm coming with you and we're going to come back, right? But then there's other people where it's almost a distractibility rather than a thought process, if that makes sense. So it's like if it's just off distracted, then it's like, oh, okay, we're just going to keep redirecting, coming back, and then helping people figure out how to do that for themselves too, right? I think that's a huge factor of like I like to incorporate when appropriate, like some coaching types of techniques too. I think that therapy for me is priority, but then when it's a lot of people just haven't gained the skills that they need to be able to navigate certain areas. And if we can help them learn those skills, then we're going to have a much better chance at seeing results that we really need. All right, this is key intervention for couples too, because I see a lot of couples. And naming the ADHD itself does provide the potential for a new narrative. So with EFT, we're talking about the cycle, right? This back and forth that happens between couples, and naming the ADHD as part of that cycle sometimes can help them recognize it's not my partner that's the enemy, right? It's just the ADHD itself. Even sometimes if we externalize it, can be like, okay, well, that's a factor. Like it's just a factor. It's not an excuse. It's a reason for how the brain sees the world, right? It's how do we work with it rather than like push against it and expect things that are unrealistic. With couples, I try to make sure that I'm not spending too much time with one partner over the other, especially the non-ADHD partner, or if there's two partners with ADHD, which happens a lot. There's usually one that's higher functioning than the other. And that's where it becomes a little challenging because the higher functioning partner typically almost presents like a neurotypical person would within this dynamic, where they feel like they're taking on all the responsibility, they're taking on so much extra, and there becomes some resentment in there for sure. And I'm trying to remember if I say this at some point in the future, but there does become almost a parent-child dynamic that happens with a partner who has ADHD and a neurotypical partner, right? Which is really challenging because we want partnership. We want equality between the two, right? We want that dynamic that's healthy and you can count on each other and you can show up for each other. But when one partner is taking on all of the responsibility, they're looking at their ADHD partner and saying, well, where are you? I don't understand why you can't do this. And again, that resentment of like feeling like they have to be a parent to their own partner comes up. But that's where too, I got side quested. Sorry. Going back to what I was talking about, it's not spending too much time with that one partner allows you to kind of slice it a lot thinner, right? We're going back and forth a little more often than I normally would. Because that ADHD partner can do what I just said. We can go on that side quest with just one trigger word, where it's like, oh, now I'm off in a different direction. I really didn't hear what my partner was saying for the last 5 minutes. And that's not fair to either of them, really, if I'm not managing, right? If I don't notice them kind of getting off in a little zone, if I'm not picking up on that, then it's just going to derail the session, honestly. So helping that ADHD partner in a way by summarizing what their partner shared in my own words and then asking for their input rather than just turning and saying, what do you think about what they said, can be really helpful. So it's like, well, I heard your partner say XYZ. I'm super curious what you're thinking, what's going through you as you hear them say this, as you see the tears in their eyes. And I'm like pulling back into that moment, basically. And I like to highlight some of the positive intentions of each of the partners, including the ADHD partner. which is like, I want to be a good partner for you. I want to show up. And as a therapist, being able to say, like, I see you, like, I see your good heart, you see your good intention, I see how you're trying so hard, right? And just acknowledging the effort that is going into it. Okay, so a few interventions that are helpful for couples. First is discovering and coming up with, how can your partner get your attention without it being threatening, without it sending that person straight into a shame spiral, right? And honestly, it could be something so simple as like touching on the shoulder before going into an important thing that they're trying to say, right? I remember being in a training, and one of the trainers said that her couples like touch their nose and like stand right in front of the other, and it's like, hey, I need you to pay attention. I'm like, that's a little silly for me. So at home, I'm like, if my husband needs me and I'm doing my thing and I'm not really aware that he's talking, I need him to touch my shoulder, right? I need him to touch my forearm, whatever it is, and say, hey, Shannon, this is really important. I need you to make sure that you're listening right now, and over time, I've been able to say, it's not like saying something bad about me, right? It doesn't mean anything bad about me. It's just, how do I show up with my best self and make sure that he's getting what he needs to? So that's where helping partners share, again, in a way that can be received from one another. Can you let your partner in to your experience? What is it like for your brain at that moment? And then picking up, did you see, like, when you shared in that way, you got your partner's full attention. Look at what you were able to do, right? Really, really validating the heck out of everybody when they do slow down and share and do something more vulnerable than they likely would have. And then also ensuring that ADHD partner, especially, is seeking some support through coaching or ADHD informed therapy, depending on what they have access to. And especially because coaching is so unregulated, it's a little tricky sometimes to figure out, the best option. But that's partially why, for me, I like to incorporate some of those elements when it's appropriate for individuals, especially. For individuals, some practical tools. And these are things, again, if people are talking over and over about how these symptoms are negatively impacting themselves and their partner, help them come up with a plan. Like, how do you get out the door in time? What does your morning routine look like? And it's literally every single step. Like, I even thought about this today as I was getting ready. I'm like, okay, well, I need to get my makeup done. I need to get my hair done. I need to make sure that hair's going to take about this much time, depending on how wet it is. And it's like literally going through every single ounce, like little minute by minute step, and helping myself come up with a plan so that I can get out the door on time, right? Because it is really, really difficult some days. And this is something nobody likes to hear, but we can't always wait for motivation to hit, right? There are going to be days we just don't feel motivated. And sometimes we just need to get up and do it. And it's really, really hard. But it's like, what is the thing that you can tell yourself to get out the door, get up out of bed, do the thing, right? And I know even for me, my mantra is, Shannon, you got to do the hardest thing. And the hardest thing right now is getting out of bed or getting your shoes on or whatever it is. But Shannon, I need you to do the hardest thing. And like convincing myself in that moment, this is worth it. It has to happen. Another trick is just to turn off all the fun notifications while you're at work. Just nobody wants to do, but it is really, really helpful just to make sure that our devices aren't just pinging all day long and taking us out of our focus. Body doubling groups are great. I had started one, and I'm pausing for the summer, but I'm hoping to pick it back up actually in the fall. So, and that's basically sitting on a Zoom call, right? We'll touch base first 5-10 minutes, and then everybody does their work for the next 20-30 minutes, organizes their day, gets a task done that they've been avoiding, and then at the end, it's like, okay, what'd you do? What's your plan for the week? And then move on, right? But it just helps. Body doubling is such a helpful tool, even within the house. Asking your partner, hey, can you just like sit in the kitchen or clean the kitchen with me? Or do you mind, making the bed with me? Whatever that is, if someone else is doing it with you, you're more likely to do it, right? And it keeps you accountable. I know even myself at the practice I was at before I started this one, I would sit with another therapist who also had ADHD, and we would do notes together. We wouldn't speak, and we would just, get it done. And every time I would drift off, because it happens, I would pick up on her doing it, right? Her typing away. And I'm like, oh, okay, I got to get back to it, and it's just literally like the visual for redirection. Like, I'm going to get distracted. How do I make sure that I catch it, right? And come back to what I need to do. And the basics are super important and very, very difficult for people with ADHD, which is proper sleep, proper eating habits, not just always, getting your treat and like getting the fun things, but which is not a bad thing every once in a while, but trying to stay active and exercise, doing breathing techniques, those are all helpful as a basis, like a baseline, just to make sure that you as a human are functioning properly. And then within context of work or relationships, being direct with communication is really important. People sometimes don't recognize that they're not speaking what's on their mind. And it's really helpful just as a reminder, hey, like, to let them know you need to make sure and share that with them, right? You need to say that out loud and make sure that you're actually communicating that, because they can't read your mind and they can't meet your need if you don't speak it. So some other practical tools. I just listed that, but anticipating conflict, what brings up fights? How do we plan ahead for this? Again, gentle physical touch to get attention. A weekly meeting is really helpful in the beginning of the week so that everybody can look over their shared calendar and talk through anything that's coming up, just to set expectations. Because again, you can't meet expectations if you don't know them. And then making things visible. So putting keys by the door, putting your meds next to your toothbrush, making sure that it's out and able to be done. And then being very, very specific with your needs and what needs to take place is super helpful. So in conclusion, ADHD is challenging at times, very challenging. But understanding and listening to your client's experience can really help them feel seen and heard for what they're going through. Helping your client slow down over time is super important. But those first few sessions might feel overwhelming and might feel like you are not getting a word in, and they are still beneficial, right? They are still vital for that person to be able to gain trust, gain rapport with you, and feel like they're being heard. And it's okay not to have a ton of interventions at first. You can gradually include things. It doesn't have to be a full-on coaching session that first session, right? Over time, you can incorporate these little details and help them to figure out the skills that they need when they need them. But I usually wait for the need to show up within session, and then we talk through it, right? But it's okay if it doesn't look like you're giving a whole lot of tips and tricks in the beginning, especially. Yeah, let's see here. And then I did have for therapists, if you don't have online booking and calendar system, make sure you have it. If you have ADHD, this is huge. ChatGPT for treatment plans is helpful. So that way you're not getting distracted and trying to think through the perfect thing over and over and over. Making sure you're taking breaks between appointments, or like at least at some point during the day, you're getting up and moving around in between sessions. finding a way to balance routine and variety. And because we do need routine to stay consistent, but we need variety so that we're not getting bored. And then potentially consider, because I'm iffy on AI, but AI note taking has been something that I've heard a lot of people say has been really helpful, especially if you have ADHD. So yeah, wanted to make sure. Oh, I don't. Let's stop sharing. There we go. So I'm curious. Thoughts? I know you had mentioned OCD, Christina. I know we had talked a little bit about kind of the overlap there, but ADHD in women, as I mentioned, is not studied as much. So it is very difficult because the symptoms are a lot more subtle and a little harder to pick up on, especially because women, just in society, we learn how to mask a little differently. And it really does come down to the person's experience and not always what we visibly see as a symptom. So,
Yeah, and just to add feedback there, in the past, it was really hard, I feel like, for women to get diagnosed by psych providers specifically because, so for example, I know at like Serenity Mental Health, they make you take a QB test, right? And like for myself in particular, I know I have ADHD, but he's like, wow, you did better than most people on this test. And I'm like, yeah, because I learned how to hyperfocus, right? Like, but it doesn't mean I
right.
don't have it, right? So I feel like women, like their symptoms just aren't recognized as ADHD as much as they should be. But I have noticed providers being more aware now and being willing to work with women. But I just was curious
Yeah.
about that. So makes sense.
Yeah. Go ahead. Yeah. Any other questions, any thoughts, anything that kind of goes through your mind I know it's a lot of information and I flew through it, but
Yeah, thanks so much for this. I found it particularly helpful to almost like permission as a therapist to let, especially a new client who has ADHD, process things. Like sometimes as a therapist, I can be thinking, am I intervening enough? And then I'm hearing sometimes it's not helpful, especially early on. And so let's say you have quite a bit of rapport with someone who has ADHD, they have awareness that they can kind of get tangential. What are some strategies that you would teach them in terms of if they recognize the side quests, if you will, are a distraction from being with the pain? How would you help them? Because as a therapist, I can intervene, but outside of their time with me, what are some things that they could do that you teach them? Different tips on that. Yeah.
yeah, to be more present with the pain, it sounds like, right? And I think a lot of what works with neurotypical people does work in that case when it comes to, as you're sharing this, like what are you feeling in your body, those types of things, helping the somatic experience to take place, and helping them pick up on those indicators like tightness in my shoulders, tightness in my chest. And that way, I mean, just in therapy, I feel like it's practice, so that when they go home, they can recognize, oh, my shoulders are like way up here. They're super tight. I need to release. What am I feeling right now? What's happening here? And sometimes it is just going to take time. They might still go off, but um, finding those techniques that work for them, like having maybe it is like a reminder to themselves, like relax your shoulders, or a reminder to themselves, like the body doubling. But it's like, how do you catch it? What is your visual cue? What is the thing that you can do for yourself, right? Because it's not necessarily going to happen naturally very often until it's trained, essentially, until
Mhm.
you've had enough practice. So, but giving them practice in session of really slowing it down and feeling like every ounce of that feeling, coming up with metaphors and imagery for it, and helping them kind of describe what's going on in their mind too. It's really helpful.
Mhm. Yeah, that's cool. I read we were emailing about this, the ADHD effect on marriage. And one of the things I really appreciated from reading that is it really highlights the qualities and attributes of individuals with ADHD and kind of pointed out how they're often very forgiving individuals. Like they move on quickly from things that neurotypical folks tend to maybe hold a grudge about a bit longer. And so I'm almost seeing there's a potential strength in the ability to be distractible. So that when they're sitting with that pain, perhaps there's a helpful quality about being able to shift into something else once that kind of becomes too much. But I'm almost hearing that you're kind of inviting them into a dance of coming back into their bodies and learning to be with that. So that's a helpful thing to think about
Yeah.
in trauma work. Yeah.
Yeah. Well, and I think sometimes the distraction can be a trauma response itself, right? Like, yes, it might be ADHD based, but it also might be I'm trying to get out of that feeling because I really don't like it. I don't want to sit in it. I'm going to get out of it. Like, and I'm moving back. I'm moving forward. I'm putting it to the side. It doesn't exist, right? So that's where it is tricky because, yeah, we're probably pretty good at that. But is that what's needed in that moment? That's the debate there is like it we probably do pick up on some of the harder emotions pretty quickly, but we don't sometimes we just don't want to feel it. So we're just going to keep moving, you know? So it is a response in a lot of ways as well.
Do you use any assessments? Like I use Simple Practice. So they have a bunch of intake assessments that are already in there. I'm curious if you use any of those when you're screening for new clients, whether they've disclosed they have ADHD or not.
Yeah, let me pull up because I refer out for official assessments, right? I think that like I would love to get to a point where I can provide them, but I do think that like I'm good at picking it up. I'm good at like helping them initially like screen for it. I'm trying to see like there is one assessment that I use pretty regularly and it has just very generic symptoms on there. Um, Generic indicators, but it's enough for them to say, okay, I'm willing to go get assessed. Right. And sometimes things like the QB are really helpful. Like I did my QB test and it came back, they're like, oh, geez, okay. Like I was like up and moving the whole time, you know? But it really depends on the person and how it presents. So, but making sure that they're talking with a provider who has experience diagnosing ADHD is huge because they're more likely to pick up on uh, the actual indicators. So let me see if I can find if I can. I don't know if you'd be able to send it out in an email, just like well, I can give you a PDF of what I typically use just as a precursor.
Uh-huh.
It's nothing intense, just a one-page indicator of like, okay, maybe we should look into this a little more, basically.
Yeah.
So,
Yeah, that'd be
yeah.
helpful. And for folks who might not be aware with the QB, can you talk a little bit about what that is and what maybe some of the
Yeah.
challenges of diagnosing are?
Yeah. So QB test, a lot of psychiatric practices will use them as a potential indicator for ADHD. It's funny because I remember them telling me, don't Google it, don't learn about it before you walk in because we don't want you to cheat. And I was like, okay. But essentially, there's a sensor that they place on your forehead, and then you click through a series of images that are like shapes that are different colors, right? And it's typically, I think, if I remember right, click if two in a row are the same color or the same shape, right? First 5 minutes, I'm like, I am crushing this. I am so good at this. Like, there's no one who's ever gotten a better score than me. And after about 10 minutes, I'm like, okay, well, how long is this? Like, how much longer is this stinking assessment? Because it's the same thing over and over and over. And by the end of it, I was literally like fidgeting up in my chair, like can't sit still. And I'm just like, I don't know how much longer I can handle this because it was the most boring task I think I'd ever experienced. So that's for people like me, which I thought that I had inattentive form of ADHD when I walked in. They're like, no, you actually have some hyperactivity based on the way that you're moving around and based on that. And I mean, the whole time we've been talking, I've been fidgeting with stuff. So we use a lot of fidget tools in my office, different things. There's actually a toy that I have where you can like place these plastic strings in and pick them out. It's great for people who have like skin picking types of issues. When they get nervous, they're kind of like seeking that. So they can do this. There's firmer versions of fidget toys if people like kind of that almost pain stimulation, in all honesty. So yeah, there's a lot of different things there, but QB is just another indicator, just another testing mechanism, basically, but it's not the end all at the same time. So, but it would not surprise me if your client goes to a psychiatrist and they do a QB test. So,
Say that last part again.
oh, I said I would not be surprised if you refer someone for ADHD testing, and that's a factor. That's a component.
Mm-hmm. Yeah. Yeah, that makes sense. Well,
Yeah.
anyone else who has questions, feel free to unmute and bring your voice into the room. This has all been super helpful information. Even just hearing you talk about like how to work with your client a little bit differently or frame your question a little bit differently is so helpful. And thinking how do we take some of the mental load off of our clients in that work. Yeah, that was really helpful.
I
Anyone
just
else
wanted
have?
to repeat. Oh, sorry, Elaine. Go ahead. Oh, okay. I wanted to repeat something you said because I loved it. It like really clicked for me when you were talking about it. It's very similar to EMDR, right? Where you said sometimes they need to talk and process because they're just like lighting up all the neural network of memory to get to what they need to get to. And it felt very EMDR to me of like they just need to process and talk just like the adaptive information processing, right? Of like they just needed to process and then they could just get there on their own. So I love that because there are some clients that I think you see it come back around and they just needed that time. But then I also know the clients that go on tangents. And so just to be able to, that was just very relatable to hear that. And also some of my clients, I'll ask, do you want me to interrupt you if I feel like you're going on a tangent? I get their permission and they're like, yes, please. And then that way it's like, again, just that like combined approach of being able to interrupt if that's what they want to. So yeah, anyways, I really love that point that you made.
I love that. Yeah, and it's really helpful because you mentioned some do one, some do the other, but like picking up on who is each client, right? Is the ones that like they have a related story basically that's like stuck in their head and they need to speak it to be able to make their point, which I also see sometimes in couples. Like the partner gets a little frustrated, a little irritated because it's like, what does that have to do with anything? And they're just trying to relate and make a point. But then, like you said, there are some people who are just gonna go do their thing, and then it's like, oh, what were we talking about? Kind of feeling. So, yeah, we can catch that.
Yeah, and I feel like one of the ways, and you can tell me if this is true, I know we got to wrap up soon, but if their energy level is really like, right, like, and that's typically indicating, right, like more distraction, would you say, versus,
Yeah.
'cause I feel like that's when I've noticed them be more like all over the place and not on that same pattern. So I don't know if you've seen that or not, but that's what I've noticed with some of my clients.
Yeah. I think each one has such different personalities that for me it's hard to say, but it's just a learning process.
Awesome. Well, Shannon, if folks want to know how to get connected to you or if you're going to be launching the body doubling group for therapists in the fall, yeah, just let folks know how to get in touch with you.
Yeah. So my website is seenknownlovedtherapy.com. You can always reach me through there. And then I'm moderately active on social media. So I've got two different Instagrams. One's for myself as a therapist, and it's shannonworle.therapist. And then there's one for my practice. So seen.known.loved.therapy. But yeah, you can definitely find me on either of those. I love talking with other therapists, so I'd love if you reach out. It's so much fun to me to be able to get to know people, and I feel like that's how we grow, right? Is by really connecting with others and being able to hear their views too.
Yeah, awesome. Well, thank you so much for sharing your time, your expertise. This has been really valuable. So yeah, we'll be in touch. Thank you everyone for joining. Have a good rest of your week.
Thank you both.
Thank
Good
you.
stuff.
Bye.